It is one of the world's most lethal viruses, with up to 9 in 10 infections ending in death. Right now, parts of Western Africa are in the midst of another outbreak of Ebola. Nearly 700 people have died since late last year, and it may now be spreading even further.
The outbreak is centered in 3 countries, Guinea, Liberia, and Sierra Leone, and officials are concerned that it could spread. Nigeria just reported its first case in Lagos, where a Liberian man died in quarantine. He fell ill during an air travel on a series of flights that originated in Liberia.
So this is an emergency, and we are already in trouble. We are already fighting something that is very, very large. It is going to get a lot larger if we do not get a lot more resource.
Health officials believe the real tally of infections is much higher than they can confirm. That's due to widespread regional fears. Relatives and friends of those infected who believe hospitalization is a death sentence. Many don't trust Western doctors or medicine. Video provided by the World Health Organization shows the all too common ending of the infection: workers burying the bodies of Ebola victims. In this current outbreak, the death rate is about 60%. Even burial must be done carefully because contact with the bodies could spread the virus. Health agencies say they fear the outbreak may get worse.
Since we opened the case management center, we have seen more than 120 patients coming to the case management center. Around 90 were positive tested of Ebola, and I say also always, I think it's a tip of the iceberg because it's missing that a good surveillance system is in place.
The virus is infecting even those trained in how to prevent its spread, like American doctor Kent Brantley. The 33-year-old had been treating Ebola patients in Liberia. He fell ill last week and isolated himself early on. He's still in treatment, and his condition is said to be grave.
Kent is confident that he followed all of the appropriate protocols and never breached protocol. So the source of this infection is uncertain at this time, but he took great care for himself and for the others under his supervision while he was running that unit.
American missionary Nancy Reitbull was also working near Ebola patients in Liberia. She also is now infected.
She's doing about as well as could be expected, maybe a little bit better than yesterday, but very, very weak.
This outbreak highlights the need for us to enhance our efforts around global health security everywhere in the world.
As if the virus itself weren't difficult enough to treat, doctors say poor health infrastructure and a lack of manpower in West Africa makes matters even worse.